also your commitment and call to action around helping to eliminate the stigma of the disease of addiction. So, as everybody knows, September is Recovery Month, and as Director Carroll mentioned, I am 18 years now in long-term recovery from alcohol addiction, and I am deeply grateful for that because I too, like Larry, would not be here today at the White House. I don't know where I'd be without my recovery, so I'm deeply grateful. My struggle with addiction started when I was young, when I was in high school, and followed me for 20 years of my life, including 8 years of relapsing. Two things were really important to me in finding recovery. One was asking for help, and the second was an incredibly supportive work environment and a deeply understanding team leader that was pivotal in helping me find recovery. When I became First Lady, I decided to share my addiction and recovery story publicly, which I had not done before, and at that point I had 15 years of recovery. That led the governor and I to start an initiative called Recovery Reinvented, which actually started as a one-day event focused around eliminating the stigma of addiction, but has really morphed into a statewide initiative with a lot of people focused on a lot of efforts around eliminating stigma. Those early years that we've hosted the conference, we've had it for 3 years now, we really had a population and an audience that was already deeply engaged in behavioral health and recovery and addiction. We decided to pivot and focus, about a year ago we decided this, and focus on corporate America, a non-traditional audience that could really make a big impact in eliminating stigma. So this year at Recovery Reinvented, one of our initiatives, we have our fourth Recovery Reinvented will be happening this year on October 28th. It's all virtual, but our initiative one of them is focused on eliminating the stigma of addiction and building recovery support in the workplace. So when we pivoted to this a year ago, I decided that in my speaking engagements, I would focus on businesses, and I would focus on eliminating the stigma of addiction. So I spoke to two really big audiences. One was the Chamber of Commerce for all the little cities across the state of North Dakota, and the second was at the Amazon Web Services Public Sector Summit. And then I decided to, at those events, ask people to stand with me and be a face and voice of recovery at these big business events, which you could have heard a pin drop in those rooms when I asked people to stand with me, and people did. And then there was thunderous applause and support for those people. And that's really what a recovery-friendly workplace should be like. It should be an environment where there's no shame in admitting that you're in recovery and that you're a face and voice of recovery, or that you're a person that's struggling and might need help. In North Dakota, we are all in on the concept of peer support specialists or peer recovery specialists. And there are two reasons why we're all in on that concept. And one, it's because 50% of our state is rural, and we're never going to have all the behavioral health services that we need to reach people struggling in all corners of our state. And two, because it's a career path. It is a career path for people that have struggled with the disease of addiction or behavioral health and have criminal backgrounds and cannot find jobs. So it is a career opportunity also. We have 472 people trained in our state as peer support specialists. We have a certification for them, and Medicaid reimbursement is now in effect for that service in our state. At this Recovery Reinvented event that we're going to have on October 28th, we are focused on we're focusing on a lot of people. We celebrate people that do things differently related to helping other people who struggle with the disease of addiction. This year we're focusing on a company called Solid Comfort, which makes furniture for companies like Marriott, Hilton, Wyndham, and Best Western. 75% of their current employees either struggle with addiction or have criminal backgrounds or been incarcerated. So they attract this underdeveloped and underutilized pool of candidates through their program called Solid Start. They actively recruit team members that were incarcerated. They participate in job fairs behind the prison walls. They maintain relationships with probation and parole officers, local judges, and drug court administrators to keep that steady pipeline of people coming to work at their location. They believe that the greatest benefit isn't about good business for them, it's about communities they serve, helping empower people with second chances to remake their lives. And they know that when we all do better, we all benefit. So in closing, I believe the two most impactful recommendations that I can make today to support building recovery-friendly workplaces are, number one, encourage businesses to contract with peer support specialists as an extension of an EAP program. And number two, have senior level executives and managers focus on eliminating stigma by talking openly about addiction and mental illness, which can turn into a culture of openness and a safe environment for employees to talk about the issues that they face. It starts at the top level. It's not only a human resources function to create culture in organizations. So thank you again for inviting me to be a part of this discussion today.